Hello everyone. Just look at this ECG. Can you find any abnormalities? This ECG belongs to a patient who underwent cardiac surgery and she was in cardiac failure, so high dose diuretics were given. If you see carefully in lead V3, V4, you can see two peaks. One is T wave and the other is U wave. So this ECG shows the signs of hypokalemia. Let's see this in detail.
Hypokalemia is defined as serum potassium less than 3.5 milliequivalents per liter. Moderate hypokalemia is defined as serum potassium less than 3 milliequivalents per liter. And severe hypokalemia is defined as serum potassium less than 2.5 milliequivalent per liter. The first ECG change in mild hypokalemia is flattening of T wave or T wave inversion. Moderate hypokalemia causes mild ST depression, QT prolongation, visible U wave, and ventricular extrasystoles. It should be noted that U waves are often best seen in the mid-precordial leads, that is V2, V3 and V4. Severe hypokalemia, that is when serum potassium level is less than 2.5 milliequivalents per liter, it causes torsade de pointes and ventricular fibrillation.